cycle. It's recording. Go ahead.
It's cycle 2, day 4. I said 3 a second ago, but it's day 4.
That means we are done with certain medications and on to other medications. The biggest change, I think, for me has been Paladin's hair. It's fairly bald. Yeah. His mood has improved drastically, though, so there's that. But other than starting new medications, things have been fairly normal. Just doing the chemo stuff.
Better turn it around. Here. Now cover.
Oh yeah.
Oh, you want to erase? Okay. I'll do it.
So we met our actual doctor, Dr. Fairer.
Fair. F-A-I-R is what she said.
Oh, it is.
Yeah.
Fair. Okay, so I was right. Yeah, okay. Dr. Fair, he's been out of town for the first little bit, but he's been following Paladin's case. Apparently he's our actual doctor, setting things up, in charge of everything. Just met him yesterday, talked about quite a few things with him. All the doctors we thought were our doctors are not our doctors, but they were our doctors, but they're not anymore because we're not new patients anymore.
Yeah, I don't understand it. It doesn't make any sense. They keep saying, you're on team this. And we're like, yay. And then they change their mind. No, never mind. You're going over here. And I'm like, oh, okay. So, it doesn't make sense. Paladin. I don't want to erase it for you. I'm sorry. Can you do that?
Erase it bigger.
Dr. Fair is helping us get set up with a different surgeon. While we recognize that everybody can make mistakes and that he did well the second time, we kind of have lost the trust factor there with that surgeon, so we asked to be placed with a different surgeon, and so they're doing
For
that.
me, it was a lot about the personal, the
Personability, is that even a word?
investment,
Yeah.
personal investment to Kaladin. Whenever he came in to talk to us, he never actually called him by name. Everybody else here has always called him by name, asked, what is he like, what are his favorite toys, what are his, just getting to know him personally. Even if they're not involved in that aspect of his care, they get to know him personally. How old is he? How's he doing with this? How's he doing with that? Getting to know him on an individual level. With this other doctor, it was always the patient. Even when he was the child. The child. Even when he was in the room. And he never even asked what his name was. And then he missed the biopsy. And so when Dr. Fair came in, he says with it being anaplastic, there's a lower percentage of a cure rate than normal Wilms tumor. And so I said, if the people who are in charge of his treatment aren't 100% invested in him and fighting for every percent that we can get for curing this, then I want somebody else. And they can say words all they want, but it's the actions that really speak to me. And so for me, that was the big reason why I wanted to step away from one surgeon and go with the other. So sorry to butt in.
So yeah, no, that's great. So yeah, so there's an update there. We're gonna do scans in 2 weeks. I think what they said was the 1st. So we'll do scans just to see the size of the tumor, see how much it shrunk, and stuff just to prepare for surgery. Surgery will be a week after that, and then radiation will start about a week after that. So the timeline's a little
Chemo is
rocky.
happening continuously
Yes.
through all of this as well.
So we'll be seeing if we're going in the right direction at least soon, which is nice.
You got that?
Scans, radiation. Oh, so if you follow was on the chemo makes him super nauseous. Well, has the potential to make him super nauseous, and so they've been giving him anti-nausea drugs. And one of them is a steroid, and one of the side effects is that makes him really moody. And we gave it a shot, and clearly it was not great for him. So we got him off of that, and he has done much, much better since then.
The one thing I want to point out with that is, while yes, he was on the steroid and that made him moody and that probably triggered the meltdown, there have been several similar meltdowns not on the steroid, because he's 2, and to be honest, this is traumatic for him. He is naturally afraid of everybody who comes in here. Suspicious, I should say, not afraid. Yeah. He thinks they're gonna poke him and hurt him and things like that. But it's been fairly difficult to give him medication. Sometimes you get it spat back in our faces quite often, and then have to go get new doses. So while that particular tantrum, that meltdown, I'm sorry, was maybe triggered by that specific medication.
Well,
there's
I think it just aided in the extremeness of it.
Right.
I think the tantrum would have happened no matter what, but how quick it came on and how extreme it was, because I've never really seen him hurt himself because he was so frustrated and didn't know what to do, and so.
You know that?
Well, and it was hard. Oh, thank you, because if I was trying to. I was trying to help him not hurt himself, and he felt like I was trying to pin him down, constrain him, I guess, which was, but chemo syringe is done. Anyway, we'll go get the lady in a second, but yeah, anyway, it's tough, but he had a good day yesterday. He was pretty happy yesterday. So we went to the Ronald McDonald family room. And we had cookies. Oh, okay. We had cookies, and he was just sitting there and singing along and hanging out. So he does do well here. They try to take care of him. So
The biggest problem we face currently is boredom, and not just with us, but with him as well. He's got access to any book he can imagine. He's got a tablet, he's got an Xbox, he's got any toy he can imagine. But there's still something about being cooped up in a room. You just get bored. And,
fancy.
yeah. So sometimes we just need to get out. Before we started chemo today was one of those times. He just wanted to really just get out. So I picked him up and said, "Okay, peace, we're out of here." And we went to the school and got some books and just kind of cleared our minds of the space. And when we came back, it was much better.
He is getting a feeding tube later today. While he is maintaining his weight, which is more than they actually expected, we kind of want him to gain some weight before surgery and radiation, because he will likely lose weight during those. And so he'll have a feeding tube, and he won't be hooked up during the day, so it'll just be normal. He'll just have the tube always. And then when he goes to sleep at night, we'll hook him up to the feeding bag and feed him and feed him while he sleeps. So they call them night feeds.
The old feed bag.
Yeah. So he'll be getting some extra calories, so he'll be able to eat normally throughout the day, and be able to play without being attached to cords and stuff like that, and then while still being able to give him the extra nutrition that he needs.
The calories.
got a spiffy, cool new room. I don't remember if Dane said that. Dane just did a tour on a different video, so we can show you that.
Showed you all the garbage bins.
Yes,
She
he
was
went
excited.
into depth on the garbage bins.
Look, there's a design that needs to happen to follow.
And out of all of the cool things in this room, it was not the garbage bins that I was planning on spending time with. But that's okay.
From this angle, it looks very similar. It's actually like a third again, like bigger.
Bigger. It's
Bathroom is
super nice.
smaller,
Which
but
is still fine. I mean, it didn't need to be as big as it was
Right.
in the other rooms.
but everything's bigger and better and upgraded and new technologyized and it's
It is, however, so it's in a new unit. We get locked in, like legitimately locked in. We cannot leave.
on our own.
On our own, yes. Like we have to find a nurse to get us out.
A nurse with the right permissions
Yes.
to open the right door.
So,
to
like,
let us
for
out.
example, last night at midnight, I had pumped and was gonna go put the milk in the fridge so that Millie could drink it later. And I could not find a nurse to save my life. So I was wandering around the floor looking for a nurse for honestly like 10 minutes. Like searching for somebody just so I could go put the milk in the fridge. And then this morning when I went to go get the milk so I could feed her, the door had just closed, so I just missed it, and there weren't any nurses nearby, so I just kind of stood by the window at the double door and waited until one of the moms came over and she unlocked the door for me.
Now,
Like, I'm sorry, I just get stuck. Like, there's no way to get out of here without a badge.
an actual badge. To be clear, they do give us a code, so normally we should be able to get out. However, the one door that we need to get out of, our code doesn't work on, and that's because this area is a newer area.
So they'll fix it. It's just we're just currently locked. So
Just one of those things about you get the new nice big room,
Yeah.
but you're locked in.
yeah. But
So
that's all. I think that's everything.
yeah.
I think we're all caught up.
We're just doing chemo. We're hanging in there. It is rough. It's hard because kids are all needy. Andy is seeing the
My kids.
lessening of attention because more attention is being put on Cal.
Oh, I did have.
I get to take care of Millie most of the time, which I absolutely love. She's just so adorable. She's started talking, and when I say talking, making noises, and smiling, and just being so cute. So I get lots of good quality time with Millie because
I know.
Cal loves mom time, and mom sometimes is the only person who can get things done. But he loves dad too, huh?
The Cheapers, cooking pie. I don't know why. I know, sorry. We get the internet working. Poop. Oh, we get to be home for 2 weeks. So we get to, once we go home, we get to be home until the 1st. Like, don't have to come in again until the 1st unless he gets a fever or something like that. And then they will have home health come and give him a shot on Saturday. And that just helps his neutrophils. Neutrophils.
It is neutrophils.
Neutrophil counts boost up as
What's
you
your
get
birthday?
quicker, faster. It's 3/8/20. What? The snack? The snack? Okay, I'll get it just a second, okay. So they'll come Mondays and Thursdays for the next 2 weeks so that we can get labs and make sure that his counts are good. And then on the 1st is when tentatively we are scheduled for the MRI and the CT. So, yeah, I think that's it.
I think that's
For reals
everything.
this time. So,
Thanks for
Thank you.
bearing with us. Thanks for your thoughts, your prayers, your love, your support, everything you all do for us.
I'll go get it.
And until next time.